Hey future doctors, today we are going to see about immunity. So immunity is defined as resistance offered by the host against the microorganism or any other foreign bodies. So immunity can be also divided into two types, innate and acquired. Innate immunity is defined as which is present right from the birth, and acquired it is acquired during the course of the life. Then immunity it is divided into innate, acquired, and then acquired is also divided into active and passive. Active immunity is developed by its own antibodies, and in passive there is ready-made antibodies. Then again active immunity is divided into natural and artificial. Now natural it is exposure to the infectious agents, and in artificial we can give the immunization. The next is passive. It is also divided into natural and artificial. In natural antibodies, it is the maternal antibodies which is passed on to the fetus. And the next is artificial. In this, we can give antibodies from any other source. Now we will see all these things in the detail. First is innate immunity. It is a first line of defense and it is a non-specific type of immunity as well as it is present from the birth. And innate immunity plays immediately after the body comes in contact with any microorganism or any substance. Now there are some silent features of the innate immunity. First, it is faster than inborn. Then it provides first line of defense against infection. Then it does not require any prior contact with the pathogen or any antigen, as well as it is non-specific and it does not have memory component. Now next topic is component of innate immunity. So it comprises of 4 defense barriers. First is anatomical barrier, then physiological barrier, then cells, and last is complements and the inflammatory barriers. So let's see one by one. First is anatomical barrier. So first is skin. It prevents entry of microbes. It kills microbes by the intraepithelial lymphocytes, which produce sebum. The next is mucous membrane. It prevents entry of microbe by producing mucus. Then cilia. It is present in the lower respiratory tract, which propels the microbes outside. And the last one is normal flora. It is present in intestine as well as respiratory tract. The next is physiological barrier. The first is temperature. It inhibits the microbes growth. Then low pH. It also inhibits the microbe growth and kill the pathogen. Then secretory products from the mucosa, that is saliva, tears, trypsin, this damages the cell wall of microbe, and gastric juice, this kills the microbe, and bile salt, it also interfere with the cell membrane. So this was all about anatomical and physiological barrier. Now we will be going to see about cells. First is phagocytes. Phagocytes are the cells which engulf the microbe as well as kill it. There are 3 types of cells which does the phagocytosis. First is neutrophil, monocytes and macrophages. So there are 3 stages of phagocytosis. First is engulfment of microbes, then fusion of lysosome with the phagosome to form phagolysosome, and then finally a microbe is killed. The next is natural killing. Kill the virus infected cell as well as tumor cells. Then third is dendritic cells. They respond to the microbes by producing numerous cytokines. So basically dendritic cell produces cytokines and this initiates the inflammation. As well as these cytokines acts as a transporter for the antigen from skin to the lymph nodes. Hence this serves as a bridge between the innate and acquired immunity. The next cells are mast cells. This is present in the epithelial lining of respiratory as well as other mucosa. This releases histamine, prostaglandins and cytokines, which also initiate the inflammation as well as proteolytic enzyme which result in the killing of bacteria. So this was all about cells. Now we are going to see about complement response. So complement activation, it leads to lysis of target microbes as well as stimulate inflammation and acquired immunity. Now first we will be going to see about inflammatory response. So there are some events which occur in this. So first is vasodilation. It occurs due to the release of vasoactive substance from the damaged tissue. The next is leakage. There is a leakage of plasma proteins. Then third is recruitment of the phagocytes to the site of inflammation. Here are some steps. First is margination, that is adherence to the endothelium, then rolling on the endothelium as well as extravasation which moves out to the blood vessel, and then migration to the inflamed site. Is that the tissue get damaged and it releases mediators which induces the capillary impermeability. Second step is leakage of the fluid as well as cells, plasma proteins and that all things. Third process is phagocyte migration, and then fourth process is phagocytes and exudate destroy bacteria. So now we are going to see about recruitment steps. So first is margination. This is a phagocytic cell which is adhered to the endothelium, and this process is known as margination. After margination, there is rolling on the endothelium. After rolling, there is extravasation. It means it moves out of the blood vessel. And then finally, it gets migrated to the inflamed site. Then fourth is engulfment of the microbes as well as dead material by the phagocytes. And last is destruction of microbes. So it's all about inflammatory response events. So now we are going to see about cytokines. So the cells secrete several cytokines which mediate many of the cellular reaction of the innate immunity. So first is TNF alpha, that is tumor necrosis factor, then interleukin 1, interleukin 6, 12, 8 and 16. And the last is interferons. So now we are going to see about acute phase reactant proteins, APRs. So proteins synthesized by the liver at the steady concentration, but their synthesis either increases or decreases exponentially due to the acute inflammatory conditions. So as we know, liver is the primary site, but it can be also synthesized by endothelial cells, fibroblasts, monocytes and adipocytes. So APRs are divided into positive and negative. So positive APRs are the proteins whose level increases due to the acute inflammation. Examples are coagulation factor, haptoglobin, metal binding protein and complement proteins. The next are negative APRs. These are the protein whose level get decreased during acute inflammation. And examples are albumin and antithrombin. Now next topic is role of APRs. It is antimicrobial as well as anti-inflammatory. Then the metal binding protein can chelate various metals such as iron, copper and many more, making them unavailable for the bacteria. So these are 2 important roles of the APRs. So next topic is C-reactive proteins, CRP. It is an example of APR which rise in the acute inflammatory condition including bacterial infections. So CRP is so named because it precipitates with the C carbs polysaccharide antigen of the pneumococcus. and it is non-specific and it can be raised in any inflammatory condition. It is one of the most important marker for the acute inflammation which is used in diagnostic laboratories. So following an injury or inflammation, CRP level get increased by the 6 hours and it doubles every 8 hours and it reaches peak by the 48 hours. So the normal level of CRP it is less than 0.2 mg per dl. However, it increases by several folds in the acute inflammatory conditions. So significant increase in CRP if the value increases to 1 mg per dl in the heavy exercises or cold pregnancies. Then moderate increase 1 to 10 mg per dl in bronchitis, malignancies, pancreatitis and MI, myocardial infarction. Then marked increase of the CRP it is greater than 10 mg per dl then in the bacterial infections and major trauma. Then CRP can be detected by the precipitation method using C-carb antigen, then latex passive agglutination test using the latex particles. Highly sensitive CRP test, minute quantities of CRP, it can be also detected by various methods, such as nephelometry, enzyme immunoassay, useful in assessing the risk of cardiovascular diseases. So this was all about acute inflammation as well as innate immunity.